Thank you again to all of you, because this is, again, I can't stress this enough of how important each individual's effort is towards providing the support. And if you're new to providing support to this population, thank you so much for attending this meeting. I hope it provides you with a little bit more insight in your approach. Maybe you're developing a new system, maybe you're developing a new organizational flow. Maybe you're just needing some more insight on how you can provide support to this population. So thank you for attending. You're in the right place if you are new. If you are not new, some of the information discussed today, you're pretty familiar. You may be pretty familiar with these resources, but what you may not be familiar with is how they are operating now, just due to the limited contact individuals have. Again, this is fitting into our theme of adaptability and being able to adapt to basically any situation that comes up, and how we provide support. So I'm going to go ahead and introduce our first guest speaker. And this is our first guest speaker is in regards to street medicine. And as you can see on the agenda, if it does interest you, I don't know if we can play the link via Zoom. I don't think we've tried that out yet. This is new for everyone, but his name's TJ. He's from, and he can give his background, but he's providing an awesome support. So TJ, I'll leave the mic open for you to kind of describe this street medicine. And again, check out the link. It's about 6 minutes long. If you want to check it out even further, Maurice did a good job on editing those shots. So TJ, go ahead.
Hi, good morning, everybody. Can you hear me okay? Good. Well, first of all, thank you for allowing me to be a part of your coalition meeting. And I'm amazed, I'm blown away that there's 90 participants that are involved in this. And that speaks to what, the initial topic of collaboration. And I'll give you a little bit of background for myself. For the last 10 years, I've been working for a community health center and doing homeless healthcare and street medicine over in the Panhandle of Idaho. In January, I took a faculty position with the University of Washington School of Medicine and teaching part-time in Spokane. But during the course of this, I had developed a relationship with a WSU faculty member, Luis Manriquez, who is working through WSU to develop a system of mobile medical clinics that will be operating throughout the WSU School of Medicine catchment area. And so Luis and I had interacted in terms of the program that I was operating over in northern Idaho. And since that time, we also had opened up a discussion regarding the need for street medicine in Spokane. And so prior to COVID-19 and all this chaos that it's thrust upon all of us, we had a discussion going between several support agencies within Spokane and the regional health department, as well as WSU, and then my involvement essentially as a volunteer about what it would take to get street medicine going in Spokane. So a little bit more about street medicine itself. This is a very basic out front, boots on the ground approach to medicine to the unsheltered homeless in our communities across the country. If you want to learn more about street medicine and the street medicine movement, there is a website for Medicine Alliance in the United States, and so that is a good access point. So my involvement in this as COVID-19 struck was that I volunteered for a COVID-19 monitoring program through the Spokane Alliance, and then also became a volunteer with Spokane Regional Health Department. And initially my involvement was going to be with the facility that has been put up at the fairgrounds in terms of our ability to monitor COVID-19 patients or potential COVID-19 patients, which was called the isolation facility. but the need for volunteers there was really not very high. And so in meeting with Luis, we felt like there was a real need for us to be out on the streets of Spokane, as well as in the encampments, to being able to screen for respiratory illness. And you all have heard the signs and symptoms of COVID-19, which have evolved somewhat. But we really felt that there was a need to be out on the streets and the encampments surrounding Spokane to screen those folks, test them when needed, but also just to be providing some general much needed health care. The idea behind street medicine is that we want to be out with the people and having direct contact with our homeless community, because as you all know, there are a lot of the homeless who are living unsheltered, who simply will not or cannot go to our clinics, though we have ready access to multiple medical clinics that are in close proximity to the downtown corridor, and are readily accessible, both with the Providence House of Charity Clinic as well as the downtown Chaz Clinic, but and all of the Chaz clinics for that matter. And if I'm leaving anybody else out, then I apologize. But there is just a certain percentage of our homeless population that simply can't or won't access healthcare there. So the idea of street medicine in and of itself is to be amongst the people and going to the people. And that's really the mantra of street medicine. So background was we had a street medicine program that we're planning, and COVID-19 really brought it forward, maybe a little quicker than we had anticipated. But when we talk about collaboration, this has been the most amazing project that I've ever participated in, both with the WSU School of Medicine and the Regional Health Department, but really all of the service agencies that are out there providing services, undaunted by COVID-19, and those outreach workers that represent those service agencies have welcomed our street medicine teams with open arms and have facilitated us getting amongst the people so we can do the work that needs to be done. So the primary mission was to screen for COVID-19. And if we felt like we had people who had positive respiratory symptoms, our options were to refer them to the isolation facility, or more commonly, to have them shelter in place. So as you all know, with our same unsheltered homeless population, many of them who are living rough or sleeping rough in encampments or on the streets have concerns about going into shelter, and they have concerns about going into clinic. And so that's the foundation for our outreach. And so because we had the connection with the outreach teams from several agencies, we were able to develop that relationship and be legitimized to a certain extent, because all of those outreach workers know the people and have provided us the connection to be able to meet with our unsheltered homeless and do the COVID screening. And it's really opened the door for us to be able to as well provide needed healthcare at the point of contact, as well as with our relationship with the health department to provide screening for COVID, testing for COVID, but also some other projects that they're working on in terms of immunizations for hepatitis A, which is a huge problem in Spokane currently, as well as STD screening and treatment, which we can do at the point of contact, which to me as a medical provider is another amazing collaboration. So this is it's an awesome opportunity. It has been a tremendous collaboration, which we are hoping is going to continue to grow as more and more service agencies who are coming back online to do outreach, make themselves available, and we are able to expand our street medicine efforts to continue to do this outreach.
Thomas,
Yeah,
or do you go by Tom?
TJ.
TJ.
Yes.
What is and please, audience, if you feel like you want to ask a question, direct all your questions into the comment box, and we will kind of go through them as they pop up. And given the time constraints as well, we'll just take one each one. But a few questions I have for you is, what is the extent of care that you provide? How do you find these individuals? And how are referrals made if you're thinking that they're needing more extensive care?
So some of the real the infrastructure, so to speak, that needs to happen with street medicine programs is still pending. And I think that some of those things we're trying to work out. That would be like access to medications, as well as access to electronic health records. These are programs that we're in the process of working and trying to develop. And so ultimately what we would like to be able to do is admit our unsheltered homeless patients into a healthcare system, and then provide them with access to the healthcare system, whether that would be Chaz or the Providence Clinic or Providence. What we want to do is be the very initial entry point for getting people in contact with needed health care. And so as far as the scope of what we do with street medicine, the starting point right now is just simply making contact and providing the very basic care that we can. As you all know, we have lots of neglected health issues, be that from skin issues, infections, a lot of foot problems, a lot of illness and respiratory illness, and so all of those things. But ultimately, what we want to see is making sure that we can maintain access or gain access to housing, to treatment, to medication-assisted treatment, and so as of right now, we are in a very basic mode. Our contact has been led by outreach workers from multiple agencies, from SNAP to Jules. We're just working with whoever is still doing street outreach, and so we have been trying to go to any areas where we know we have folks that are living unsheltered. But we also have done some outreach to some of the shelters, and so we're working on wherever we can gain a point of contact for someone who needs assistance. We've had people who have not been able to get medication refills, and so through our licenses, we've been able to do that. So we've been able to refill medications for people who've not been able to get access to their medications and keep those medications going, or getting them reestablished. One other thing that we've been able to do is when we come in contact with someone, if we get the information that we need and that they have a primary care provider, then what we'll try and do is reach out and get them a follow-up appointment scheduled. And we've been able to do this on multiple occasions with Chaz providers at the Denny Murphy Clinic. So we don't want to, or when I say we, the street medicine program wants to be about collaboration. We don't want it to be perceived that we're in competition with anybody, that we're trying to take over for anybody. We want it to be a project where we are providing the next level of care, the most basic level of care for that patient population that simply can't or won't come into the medical clinics. And then one other benefit is that if we can come in contact with someone and initiate care, we may be able to reduce the number of emergency department visits and reduce the burden on the emergency department for folks who just simply do not need that level of care, but certainly need care. We would be in hopes that eventually we'll be able to have an electronic medical record system, as well as access to medications, whether that be through the Washington State University School of Pharmacy, or potentially through Chaz or Providence, or whatever that looks like. We don't know what that looks like right now, but it is in the works.
Yeah, and with the you mentioned the electronic health record. One of the questions that came up from Dale here is this street project using the homeless management information system? So what's called HMIS?
I would say no. What we've been doing at this point is we've been recording our encounters on paper, and then with those will be screened or will be scanned into a health records information system at some point. I don't know a lot about the homeless management information system, but I'm willing to learn. I think as we evolve, that communication is going to be the key here with all of the service agencies as we connect with more and more patients who are on the street, but also knowing that this collaboration, we're hoping it's going to grow. So.
Thank you so much, TJ. And I want you to everyone to just again keep in mind the chat box is blowing up. So if you feel like you have answers or questions to the responses, feel free to chime in, as I'm sure that they will come up, because there are a few questions. We do have to move on to the next presenter, but TJ, thank you so much for introducing to us this approach of street medicine, where you're taking the initiative to basically provide support to individuals who are choosing to continue camping or staying out, away from maybe the systems that maybe they've lost trust in. But thank you so much for doing that, TJ. That's awesome.
Sure. One last thing, and I don't mean to set you off of your time frame, but I just do want to make it very clear that this is a collaboration with Washington State University and Dr. Manriquez and his staff, as well as multiple providers from WSU. We're really trying to pull this together to accelerate a plan for a street medicine program that really at its base will be another teaching opportunity and learning opportunity for students from WSU as well as University of Washington. So ultimately, we really want it to be an educational opportunity. I just want to make sure that I'm not just some rogue PA out there doing it, because it really has been a huge collaboration with other agencies. And it was in the works, but it's just been accelerated. And I think ultimately that's going to be a blessing for us. And we just continue to work together and expand this collaboration. And I personally feel so blessed to have met all of the folks that I've met so far, and how everybody has welcomed us with open arms, just with the hopes that we can provide more care for the unsheltered homeless in our community. So thank you all. I'm blown away by the fact that you have almost 100 people on this Zoom. It's by far the biggest one I've ever participated in. And you guys are amazing in the everyday work that you do. And we're honored as we move forward with street medicine to be able to play a small part. So I'll put my email up to everybody. If you want me to email or even give me a call, I'll put that on the chat as well. Thank you.
Thank you, TJ. There may be some questions for you in the chat box if you want to take a look.
Okay, sounds good. Thank you.
All right. So thank you again, TJ. Next up, we have Arielle Anderson, who is going to briefly and I know that she could talk a fair amount of the details into singles homeless coordinated entry and operations. There's a lot that goes into it. So I'm personally excited to hear how she breaks this down in 10 minutes. It's going to be exciting. Ariel, you have the floor.
Well, that's I was wondering the same thing, but that's cool. So again, my name is Arielle Anderson, and I work at SNAP Homeless Services. I've been at SNAP now for almost 5 years. In a couple of weeks, it'll be 5 years, and I now oversee the homeless department. So one of the roles that I have is to help facilitate singles homeless coordinated entry, really moving away from assessment, which I think historically that's how we've communicated out, not just internally amongst service providers, but out to the larger community. And so really trying to change that paradigm because it's not just about an assessment, right? So when folks come in and they say, I just need an assessment, no, you need other assistance that's not going to just be captured in a tool. And so that's got to be reflected out in the way, in language, right? So we are now, I'm trying to very gently kind of change the language. So I think one thing that singles homeless coordinated entry really embodies is this idea of collaboration, right? So it's not, yes, SNAP might be the lead agency, but in my capacity and as SNAP's capacity as lead, really what that means is it's about training, onboarding new folks to SHCE. And providing customer service. Yes, SNAP also has walk-ins and, actively participates in the enrollments and those initial conversations, but we're not the only player. It is decentralized for a reason. And what I mean by that is that not every, you don't have to just go into SNAP to receive those kinds of services. Whether it's, first we do diversion first, right? So that's the way that our system is moving. Coordinated entry cannot be the end all be all in terms of housing solution, just can't. It is one slice of that overall pie to help folks solve their homeless crisis. So we recognized very early on, many moons ago, that it was unrealistic for one agency to shoulder that amount of need in our community. So what that means on the ground is that anybody could present at Goodwill, they could present at the Women's Hearth, House of Charity, Hope House, a whole number of participating agencies, and receive the same level of conversation, and if needed, a coordinated entry enrollment in a referral that's offered through coordinated entry for a specific housing intervention. And really what that's about is reducing the ping-ponging of folks that need that assistance or in crisis mode, right? There's nothing more frustrating than going into an agency and to be told, sorry, we can't help you. Now, of course, that does still happen. But it is then our responsibility as service providers to ensure that we're making that warm handoff on behalf of that person to a different agency. But certainly in the context of coordinated entry, we have right now what we call satellites. We've got an average of around 90 satellites. That means that 90 individuals are empowered and credentialed to do the same type of work in HMIS, the Homeless Management Information System, as SNAP, as the lead agency. So, and again, what that reflects is that none of us do this work in a vacuum, right? None of us. The way that we assist and that we serve the folks that need that help is by collaboration. And HMIS kind of is that bridge to ensuring that we are working with one another. and helping to facilitate as quickly as we can, finding housing ultimately for folks, although to be fair, that's just one piece of what the need typically is. But housing is what, is what coordinated entry is about. And I will say in terms of the COVID, as Robert mentioned, we have seen and helped facilitate housing since the shelter-in-place order happened in mid-March up until the end of April. We had housed around 28 individuals. And again, that's not just SNAP, right? That's all agencies working together to make that happen. And so whether that is with other housing providers or existing day drop-in shelters that even weren't in operation, they're still very much involved, existing outreach teams. We as a community made that happen. And so that's something that in my mind really needs to be celebrated, considering just the massive shift that we saw in a very short amount of time. So.
And Ariel, so what makes SNAP different then from these other satellites? Like if the SNAP's version of singles homeless coordinated entry, what makes them, or how do you guys separate yourselves from the other satellites?
Sure. So, I mean, one of the, I guess, huge differences is that I'm responsible for training in terms of onboarding new agencies. I provide customer service for all of our satellites, so that if something doesn't look right in HMIS or they have questions about a particular housing program, I'm there to support them. The other big difference too is that SNAP happens to be one of the agencies that provides rapid rehousing. Now that's not the case for everybody, right? So the YWCA has some rapid rehousing funds. HEN with Goodwill has rapid rehousing. And then I personally am in charge of and administer the referrals that are asked for by participating agencies that are actually housing providers. So that's kind of the big thing is, I'm responsible for overseeing those. I don't want to call them a list, right? Because there's no list in coordinated entry. They're waiting pools. And then once I go into HMIS and pull that report, then it becomes a list just by virtue of it being in Excel. But a list infers that folks are static and can't change on their, where they're at maybe. And that's certainly not the case. I can run a report today and Joe Smith might be on the Excel sheet number 15, and then I could run the same report tomorrow, and now, now he's sitting at number 30. It just really depends on, who we're entering in between that time. So yeah, hopefully that answers.
Yeah, one of the questions that came up is SNAP still doing walk-in hours? If not, what does that look like, and how do individuals access services? Is it mainly through satellites?
It's through, they can, at least for SNAP, we have our own, walk-in hours. Right now, that's not happening, right? So there's no physical walk-ins. We are completely remote, so we are fielding, I would say on average, with the phones that we have, we answer probably around 90 calls between those 3 cell phones per day. And that's a substantial amount of volume. And then in addition to that, we're always fielding emails from folks. And then we continue to do the street outreach as well. So it looks a little different right now, just given with the COVID, but we're certainly still, still connecting with folks and doing what we can.
Right. Okay. And thank you so much, Ariel, for sharing. I want to direct you, Ariel, to the the chat box. There are a few questions in there that may be suited for you best to answer. Any closing remarks before you mute yourself?
Yeah, not particularly. I'm just always, as a Spokaneite, I'm just always amazed at the level of care and compassion that our community has. And I wouldn't even say, I guess I'm only surprised when I compare that to, you know, other communities that I have been in, because honestly, this is just how Spokane has always been, always. So I just want to thank everybody for all the work that they're doing.
Awesome. Thank you so much, Ariel. Yeah. All right. Thank you again. And so now we have up, it is a great resource. So I hope everyone's pen and paper is ready for this person. Rosemary Wear, or Rose, operates the Disability Assistance Project. I'm sure a lot of, at least patients that I come across, are requesting some type of consultation in regards to their SSI, SSDI, how basically people get paid. So Rose is that person who I hope you have your pen and paper ready, as she kind of talks about the support that she can provide individuals. I know the main access to Rose was through community court and other shelter avenues as well. But during this time, things have changed. So I'm sure she'll discuss how she can be reached and accessed. So Rose, you have the virtual mic.
All right, thank you, Rob.
Rose, do you have kind of like an echo in the back? I don't know if there's another mic or something linked up.
I don't think that there is.
Maybe we can kind of hear you. Just make sure you're close to the mic as you can.
Okay, I will try. Is that any better at all?
That's a little, yes.
Okay, well, I apologize. We'll kind of try to get through it as best we can. If it's the point where no one can hear me at all, then you can just tell me to be quiet. So I guess just a little bit.
Coming to an end. One of the advantages of moving.
Oh, sorry, I was just hearing some background noise there. So in terms of just a little bit of background on me, I am a Social Security disability attorney. That's what I do. I've been doing nothing but Social Security disability work for probably about 9 years now. And then 7 years ago, I started my own law office. And as part of that, I'm sorry, I was just reading a comment about was I maybe using my phone audio, but I'm not, so I don't know what to do. So as part of that, we run the Disability Assistance Project, which is a pro bono outreach service where we go out into the community and try to assist folks with social security disability issues. And that is a big part of what we do. It's a big part of what really brings joy to myself and to my staff. During normal hours, what we would do is, like Robert said, we would be a community court on Mondays. We would also do the House of Charity every Thursday morning, and then the Women's Heart every Thursday afternoon. So that was our standard. I'm going to try to turn my volume down a little bit and see if that's helping at all. Any help with the echo or no? I'm sorry, Robert, you were muted, so I couldn't hear you.
You still have an echo.
Okay. I see someone saying not everyone is muted, and that might be the problem. I'm not sure because I'm doing the same thing that I did before when I spoke earlier, and that seems to be fine. I don't know. Let me double check my audio settings and just see if there's anything different. Does that help at all? Is that any better or worse?
No, that's about the same.
Okay.
You have headphones with a mic, maybe?
I do. Let's see if that works.
All right, can you hear me at all now?
Much better.
Much better. Yay, we figured it out. Okay, so by way of background, again, I've been a Social Security attorney for about 9 years, and that's all we do in my office. A big part of our practice is doing pro bono work. So we normally go down to the Spokane Public Library every Monday, and then we're also at the House of Charity every Thursday morning and at the Women's Hearth every Thursday afternoon, where we provide drop-in services. So folks can just come in and ask us questions about their Social Security claims. So if an individual just doesn't know if they need to apply or not, or that would be a benefit, if they're somewhere in the process and they're lost and they just don't know what's going on or what they're waiting on, we can call, we can do status checks, and we can kind of check in on what they need to do from there going forward, and just kind of give them an expectation of what to expect, what things they can be doing to hopefully make their case go more smoothly. As I'm sure you all know, working with homeless individuals, it can be very challenging just to navigate somewhat simple systems, let alone navigating extremely complex and lengthy systems like the Social Security system. So that can take quite a long time, and especially if individuals are bouncing around, it makes it difficult for them to receive mail and be able to effectively navigate that process. So what we would normally do is we would go into shelters and we would be available. We bring a whole team of people and go down and are available to help facilitate these issues. We also help folks with overpayments. So if they're on Social Security, but all of a sudden Social Security says they owe them money, or with continuing disability reviews. So if they're on benefits, but now Social Security is reviewing their case, or also disability cessation. So if they've been on benefits and all of a sudden their benefits stop and they don't know why, we can help them we kind of act as a go-between between them and Social Security to kind of help figure out what exactly is going on with the case, what can this person expect, and what do they need to do either to resolve their issue or to continue the claim through the process. So again, in normal times, we would go to the shelters and do this. So the question is now, what do we do in the times of COVID, right? And that's kind of what we've been trying to manage and trying to adapt to. Certainly we are available by phone anytime. So I will post my phone number and my email in the chat when I get done talking here. So if you as a provider are working with an individual and you want to call us with that person, we can certainly see what services we're able to offer. Right now, everything is kind of up in the air. We do use a lot of work-study interns that help, and with the COVID going on right now, a lot of those folks have been forced off campus and have been returned home. So we're kind of in this evolving model of trying to figure out how we can best provide those services. So we are very open to any suggestions from agencies, things of that nature, as to whatever you folks think might work for us to be able to still do that outreach and help folks access services. So in terms of now, what we have been doing, I know Robert has called me a few times with individuals or people who have issues or problems they're trying to resolve. Normally, if we don't have someone available right then to handle that, which that can be a bit of a challenge because we're kind of on reduced staff and have folks social distancing and working from home. But if we don't have someone right then, what we can do is we can try to set up a time where someone in our office can call with that person to Social Security and figure out what's going on with the claim and what needs to be done. So that is kind of how we're operating now. I would say that the best way, if you have an individual that is needing services, is just to either give them our number directly, and we can certainly walk them through that process as best we can. Or if you have an individual who does not have a phone, you can always call us with that individual. And if we're unable to provide immediate assistance, we'll do the best we can to set up an appointment as soon as possible after that date to try to provide those services. So that's kind of it in a nutshell on where we are now. I wish we had a better answer or something a little bit more concrete or tangible, but we're just kind of, I think, like everyone else, trying to feel our way through it and see the best we can do. We're hoping that when the shelters, or not the shelters, but when services reopen a little bit more, so when the Women's Hearth reopens, when House of Charity reopens to volunteers, because right now, although they're still sheltering folks, they're closed to any external volunteers coming in to provide services, is my understanding of it. We're hoping that once those things become a little bit more open, hopefully maybe in July or something like that, we might be able to get in and do more of the kind of hands-on services that we were doing before. But for now, here is where we are.
Thank you, Rose. One of the questions that came up was, can video of someone function be used in attempts to get SSDI or SSI?
So unfortunately not. Social Security, the way that they accept evidence is extremely antiquated. So they cannot even accept color photographs. So in terms of what medical evidence they will or will not accept, unfortunately, video is not something that they can take at this time. Their systems just aren't set up to process that kind of evidence. They can take pictures. So if you have a picture of someone's physical disability, that can be helpful. We've used pictures in mental health cases just to show someone's living conditions, which can be helpful. And they can accept letters. So also a lot of times letters, even just from a service provider of, this is what I observe this person going through, very good descriptive letters. They can accept things of that nature, but unfortunately not video at this time. And then I see Zoe also had a real quick question about clients saying that doctors aren't allowing folks to come in for appointments for verification. That is a big issue that we're having right now, or a struggle, is just folks not getting access to the medical care that they need, not being able to access those services. So we are just encouraging folks to try to do virtual visits as best they can, call their doctor's office on a regular basis, just check in, see when they might be able to get in and get some of those services. And also our office has had some luck in terms of with trying to get forms and paperwork filled out. Certainly just asking individuals to speak with their providers. And then if their providers are willing to fill out paperwork, or they say, yep, I'm happy to do that, then we'll get a fax number and just fax the paperwork directly to the doctor so that they can fax it back to us. So there's not that need for in-person visits, but it is definitely more complicated.
So ideally, there needs to be kind of a paper trail documentation of a disability.
Yes. Yeah.
Okay. Great. Thank you so much for that information. I imagine there's going, if you could just take a glance at the chat box again and put your contact information up there. I'm sure that would be helpful to a lot of individuals just to have, to know kind of how to get a hold of you in these situations. Rose, any closing comments before we close up this meeting?
Yes, just briefly, just a couple quick changes in Social Security. Right now, I know a lot of people have questions about stimulus and how that affects them. Also, all phone or all hearings, people who are scheduled for administrative hearings in these cases are being pushed to phone hearings. There are some definite problems with the Social Security office being closed and access issues. So I would just encourage you, again, we're trying to do the best we can to be a resource for individuals while not being able to work in our standard model. So if you as a provider have any questions at all about the Social Security process, what's going on with Social Security. Our office does also do trainings and things of that nature, which we could do virtually. So again, I would encourage you as individual providers, if you do have any questions at all, please just call or reach out to me via email. Email is probably the quickest and easiest way to get a hold of me. If you don't hear back within a day or two, don't feel bad about bugging me again. But we are trying to do whatever we can to be available. So just please don't be shy to call or shoot an email if you need to, or if you have any questions.
Thank you, Rose, so much.
My pleasure. Thank you.
Yeah. There was, before we close, there was a comment that came up. It says, regarding new homeless shelter in Spokane. The Spokane Arena is about to become a homeless shelter, as the city of Spokane and other partners have decided to consolidate shelters. According to Michael Shaw, CEO of the Guardians Foundation, the decision was yesterday afternoon. So thank you for posting that comment. We are, as the Homeless Coalition, part of my responsibility is to improve that communication between the city and myself, and also the Continuum of Care Board as well. We are currently working on that communication. Unfortunately, I don't have a lot of information in regards to this. If there is someone from the city here that maybe could speak to that, that would be helpful. So I'll leave the mic open for a quick minute if there is someone who feels they are appropriately qualified to give that information. Okay, so in closing, again, this meeting is in regards to the theme is adaptability, how we adapt to each circumstances. As you can see, even from this posting a couple minutes ago, things change basically in an instant. We get new information, new updates, new this, new that. So our ability to adapt in this time is very important. And I want to say thank you also on behalf of the leadership team for the continued collaboration that all of you have displayed during this time. It's been very difficult to track people down, but we also have to remember that this adaptability also has to be taken into consideration from the perspective of the individuals we are working with, the people who are experiencing out of home displacement, how they are adapting to these situations. I know we kind of become focused on our little system and how we're functioning, how we can provide support, but we also have to keep in mind how it's affecting each person individually on the other side. So please keep that into consideration. Our next coalition will resume back to its normal function as being the first Thursday of each month. So it will be June 4th. It will be a virtual meeting as of now. If things change, we will keep everyone updated. And one thing too is that there was a survey that was sent out, and hopefully to get everyone's feedback as far as how you guys see the Homeless Coalition basically serving you and making sure that your voices are heard, as we progress to this new normal. So please take a minute to go over that survey, and you can return them to Barry Barfield, who is up and running. We'll take those surveys and we will take a glance at them. So again, thank you all so much for what you do and for your flexibility during this time. And I look forward to seeing your faces either not in person, but over the camera. Thank you so much, everyone.
And this is Barry. I'm hosting this meeting, and I will leave it on as long as anybody wants to stay on and either chat, either through the box or verbally.
Thank you.
Okay.
Thank you.
You're very welcome.
Okay, I'll talk to you soon.
Bye-bye. Okay, it looks like we got 2 folks left, Messy and Sin. You guys interested in staying on, or?
Hi, Barry. I was just sending Messy a reply to what they put in the chat.
Okay, that's fine then.
So, what are you staying on to talk about other issues, or?
Nope. Nope. I'm just leaving it open. Well, I'm leaving it open in case anybody wants to talk about anything. But
yeah, I was just curious. I'm doing a project on the homeless population in Spokane, and this was one of the questions that I'm supposed to address. And I just wanted to understand how you guys ensured that the homeless population's voices, regardless of their demographics and backgrounds, was included in the decision-making process of any coalitions, any meetings, and things such as that. Do you have any resources that you could guide me to, or information?
Well, I work directly with Jules Helping Hand, the MAC movement, and other advocates. I was mentored by Alfredo. Me personally, I'm two-spirit, trans-masculine. I'm a person of color. I'm Puerto Rican and Native. And those issues have risen. For instance, we had an issue, I think it was UGM, that was discriminating against trans people and using the excuse of they weren't safe to be housed there.
Interesting.
So issues like that do come up. And if you Google things like that, you'll get more in depth. Don't quote me on what I said because there's more to it. But I would definitely look that up, and that was a big factor of when the city granted UGM the land that was supposed to be for a shelter possibly. Everyone was up in arms because the discrimination, not only against trans people, but LGBT, the fact that they literally force religion upon you. That should be voluntary, that should be voluntary. That shouldn't be something, forced upon you because you're hungry and you need somewhere to stay. Also, Julie, I don't know if you've met Julie from Jules Helping Hand. She is a woman of color.
Okay.
We also have the Black Lens. That's it. They also advocate for people of color and homelessness. That is Sandy Williams. She's a good friend of mine. You also have Dua Rahima. She is a woman of color who advocates for homelessness, has worked as a case manager for homeless veterans, and the list just goes on. So there are people of color that have opinions and actually do affect decisions.
Mhm. Awesome.
I hope I was helpful.
That is very helpful. I'll definitely look up Max. I've heard of Jules. I haven't heard of Max, so I'll look into that.
It's called the MAC movement. It's the MAC movement. It's the Native American culture and music movement that has been around for over 50 years. It originally started with the Longest Walk to bring awareness to Indigenous women disappearing and being murdered.
Mm.
One of our chiefs marched across the nation to Washington, D.C. to the steps of the Capitol building in protest. His granddaughter, like great-great-granddaughter, runs the MAC movement. Her name is Drea, and the co-founder is Crystal.
Awesome. Thank you. I appreciate that.
Me personally, my name is Sin Sanchez. You can find me on Facebook.
Find me on Facebook.
If you have any questions,
Contact me.
Okay, I will. Thank you so much.
Yep. Have a good one, Barry.
Bye. Thank you.
Glad to do it.